Symptoms of Generalized Anxiety Disorder, GAD. Everyone has some anxiety, but if you have GAD or Generalized Anxiety Disorder, fears and worries can be so pervasive that they make it almost impossible to relax and have a normal life. Often people with Generalized Anxiety Disorder worry about things that have very little chance of happening. They can also feel anxious all day long for no apparent reason. Generalized Anxiety Disorder can also affect you physically. Some of the physical symptoms can be problems sleeping, muscle aches and pains, and tired all the time. Generalized Anxiety Disorder is a treatable disorder. There are many things that can help. Sam's story. Sam would worry about things from time to time, but it never really interfered with his life. Recently, Sam has been feeling on edge all the time. He has been having feelings of dread and worries about the future. These worries have not just been sometimes, but most the time. Sam has noticed that he is falling behind in his work and cannot seem to concentrate. When he leaves work and goes home, the worries continue and he just cannot unwind. At night when Sam goes to bed, he is having a hard time falling asleep. He is restless and cannot seem to fall asleep for hours. Sam also is having digestive upset. This includes diarrhea, intestinal and stomach cramps along with bloating. On top of all this, Sam has been taking aspirin 4 to 5 times a day for his stiff muscles. He wonders how long he can keep going. He feels like he may be ready for a nervous breakdown. If you are suffering from Generalized Anxiety Disorder, GAD, it is very common to worry about the same things that other people worry about. The problem becomes that these worries become overwhelming, and often you can create scenarios that are very unlikely to happen. Things like an innocent mention of the stock market turns into the thought that all your investments will be worthless. Maybe you try to call your child and they do not answer. You then start thinking of all the worst possibilities. Even the thought of getting out of bed and going to work can cause anxiety. It does not matter if you think your anxiety is more intense than others or not. The problem is it will not go away. You are always worrying about something. Generalized Anxiety Disorder is worrying about things that are not related to each other in a way that would be considered excessive. This type of worry can make your life very difficult, and being able to relax and unwind becomes almost impossible. GAD and normal worry. It is perfectly normal to have fears, doubts and worries. It is understandable that you will be anxious about a big interview or going out on a first date. What makes Generalized Anxiety Disorder different is the fears, worries, doubts are disruptive in your life and are much more frequent than the average person. As an example, if the average person was watching the news and saw a report about a natural disaster overseas, they become a little worried about the situation. Someone with Generalized Anxiety Disorder could spend the next several nights worried about something happening in their area. They may think about the worst possible thing that could happen. People with Generalized Anxiety Disorder tend not to avoid work and social situations, but they are filled with anxiety as they move through their daily lives. This can be the case even though they have nothing of any significance to worry about. For some people, the physical symptoms associated with Generalized Anxiety Disorder make everyday functioning very difficult. Examples of normal worry. Your daily activities are not affected in a negative way by worrying. You can keep your worries under control. You do not experience high stress from your worries. You only worry about things that are realistic. You worry only for short periods. Examples of Generalized Anxiety Disorder, GAD worry. Your job, social life and daily activities are severely disrupted from worry. You cannot control the worry. The worry tends to be very stressful and upsetting. When you worry, you expect the worst. You worry every day, and this has been going on for over 6 months. Symptoms of Generalized Anxiety Disorder, GAD. Symptoms of Generalized Anxiety Disorder can be different from day to day. At certain times of the day you may feel better than at other times of the day. You may also have some days that are better than other days. Stress will not cause Generalized Anxiety Disorder, but it can make the problem worse. People with Generalized Anxiety Disorder will not all have the same symptoms, but most people will have some combination of the following symptoms. Physical symptoms: muscle tension, aches, or soreness, trouble falling asleep or staying asleep, stomach problems, nausea, diarrhea, jumpiness or unsteadiness, edginess or restlessness, get tired easily. Psychological symptoms: irritability, feelings of dread, cannot control anxious thoughts, cannot relax, having difficulty concentrating, afraid you will lose control or be rejected. Generalized Anxiety Disorder, GAD help. There are many things that will help you feel better if you think you have generalized anxiety disorder. Some people find that these techniques are enough to control their anxiety. Even if these techniques do not solve the problem, they will help. Several things you can do are listed below. Find ways to handle your worry in a more positive way. This could include challenging your worry thoughts, putting off the worry to another time, and learning to accept that uncertainty is part of life. Make changes in your life that will reduce anxiety. These can include yoga, hypnosis, eating habits, cutting out caffeine, and getting support from others. Practice techniques that will relax you. These can include meditation, binaural beats, and breathing exercises. Practicing these techniques will make you less reactive to worry situations. One of the best ways to remove yourself from an anxiety episode is to fully accept what is happening. When you remain in the present, while accepting the anxiety, it will disappear. Below is a simple, aware outline to help you remember what to do when you are feeling anxious. Accept the anxiety. Let it in, welcome it. Don't try to fight it. Instead of having hatred, anger towards the anxiety, just accept it. When you resist it, you can prolong the anxiety. Try to flow with it. The anxiety is not responsible for how you think or act. Watch your anxiety. Look at the anxiety and do not judge it. It is not either good or bad, it just is. Separate yourself from the anxiety and watch it. You are not the anxiety. Act with the anxiety. Act or pretend you are not anxious. It is fine to slow down if you need to, but keep going. Breathe slowly and normally from the diaphragm. It is true, when you leave the anxiety situation, your anxiety will go down, but your fear will rise. If you stay, both fear and anxiety will go down. Repeat the steps. Keep repeating the steps. Accept, watch and act. Accept, watch and act. Accept, watch and act. Expect the best. Realize that some anxiety is normal and what you are afraid of will most likely never happen. Expect anxiety in the future. By doing this, you will be ready for it when it comes.